Hi all, in this video I will explain about anti-epileptic drugs or anticonvulsant drugs. So today we are going to understand what epilepsy actually is, why seizures happen, what happens inside the brain during seizure, why anti-epileptic drugs are needed, how these drugs control abnormal electrical activity, and different types of seizures, important drugs, mechanism of action, uses, adverse effect, clinical examples, and some memory tricks, and some real life understandings. And also, we want to see about patient counseling and emergency management. By the end of this class, you will not only remember the drugs, you will actually understand them. So, let us start from the basics. So, what is epilepsy? Epilepsy is a neurological disorder characterized by recurrent seizure. A seizure is a sudden, abnormal, excessive electrical discharge in the brain. Normally, neurons communicate in a controlled manner. One neuron sends signal to another neuron in on an organized way. But in epilepsy, the neurons suddenly start firing excessively and uncontrollably. This creates an electrical storm inside the brain. That electrical storm produces abnormal body movements, loss of consciousness, abnormal sensation, behavioral changes, or starting episodes. So, thing like this, imagine a classroom. Normally, a student speak one by one, but suddenly all students start shouting loudly at the same time. So, completely chose happen, right? That is similar to what happens in epilepsy. So, neurons lost their control. So, what causes excessive firing? So, now the important question is, why do neurons suddenly fire excessively? So, mainly because of imbalance between excitatory signals and inhibitory signals inside the brain. So, first neurotransmitter is a glutamate. Glutamate is the major excitatory neurotransmitter. It increases neuronal activity. And GABA. So GABA means gamma aminobutyric acid. It's the major inhibitory neurotransmitter. It decreases neuronal activity. If excitation becomes too high or inhibition becomes too low, the neurons become hyperexcitable. Then diseases occur. So anti-epileptic drugs mainly work by increasing inhibition, decreasing excitation, and blocking abnormal electrical firing. This is the foundation of the entire chapter. So, if students understand this concept, the entire topic becomes easy. First, we want to know about the causes of epilepsy. Epilepsy may occur due to many reasons. The common causes are genetic disorders, brain tumors, head injury, stroke, meningitis, encephalitis, birth injury, fever in children, metabolic disorder, alcohol withdrawal, or brain infections. So sometimes the exact cause is unknown. That is called idiopathic epilepsy. Next, types of seizure. This is very important because drug selection depends on seizure type. If wrong drug is given, the seizures may worsen. So first understand the seizure classification. There are two major types: focal seizure or partial seizures. The next one, generalized seizure. The first, focal seizure. The electrical discharge starts from one specific area of the brain. The symptoms depend on which area is affected. For example, motor cortex affected means abnormal movements. Sensory cortex affected means tingling sensation. Temporal lobe affected means strange emotions or hallucinations. In this focal seizures can several types. Simple partial seizures. In these seizures, the consciousness is preserved. The patient knows what is happening. For example, a patient suddenly develops twitching in one hand but remains conscious. Next, complex partial seizure. The consciousness is impaired. The patient may stare blankly or perform automatic movements. For example, lip smacking, repeated hand movements, walking aimlessly. After seizure, the patient may not remember the episodes. The second seizure is generalized seizures. The electrical discharge involves both hemispheres for the beginning, usually associated with loss of consciousness. There are several types: tonic clonic seizure, absent seizure, myoclonic seizure, atonic seizure, tonic seizure, clonic seizure. The tonic clonic seizure means this is the classic seizure. Most people imagine tonic phase. The body becomes rigid, muscles contract strongly, the patient may fall, breathing may stop temporarily. In this clonic phase, the jerky movements occur. Repeated muscle contraction and relaxations, tongue biting may occur, urinary incontinence may occur. After seizure, the patient becomes confused and exhausted. This is called postical phase. Next, absence seizure. It is common in children. The very brief episodes. The child suddenly stares blankly for a few seconds, then returns to normal. So, no major body jerking. Teachers may think the child is daydreaming, but very important clinical point, ethosuximide is a drug of this choice. Next, myoclonic seizure. The sudden brief muscle jerks, like sudden electrical shock movements. For example, suddenly dropping an object from hand. Next, atonic seizure. The sudden loss of muscle tone. The patient suddenly falls. So also called drop attacks. Next, status epilepticus. This is a medical emergency. The continuous seizure lasting more than 5 minutes or repeated seizures without recovery. This can cause brain damage, hypoxia, death, so the immediate treatment is required. Next, the principles of anti-epileptic drug therapy. So before learning drugs, we understand the important principles. So first we want to start with a single drug. This is called monotherapy because fewer side effect occurs. Next, start with low dose, then it gradually increases. So never stop suddenly. Sudden withdrawal may trigger severe seizures. And the drug selection depends on seizure type. Next, the long-term compliance is essential. So many patients stop medicines after feeling better, then seizures return. The patient counseling is very important. Okay. Next, mechanism of anti-epileptic drugs. This is the heart of pharmacology. Okay. First, the sodium channel blockers. During action potential, the sodium enters neurons. This causes depolarization. Some drugs block sodium channels. This prevents rapid repetitive firing. For example, phenytoin, carbamazepine, lamotrigine, valproate. So you can think like this. Okay, neuron wants to fire repeatedly. The sodium channel blockers close the gate, so excessive firing decreases. Next, increases GABA activity. So GABA is an inhibitory neurotransmitter. Yet increasing GABA means calming the brain. For example, benzodiazepines, barbiturates, valproate, vigabatrin. So you can imagine GABA is a brain brake. Okay. And epileptic drugs strengthen the brain. Next, calcium channel blockers. It especially T type of calcium channels. It is important in absence cases. For example, ethosuximide. Next one, the reduced glutamate activity. Glutamate excites neuron. So reducing glutamate decreases excitation. For example, topiramate and felbamate. So let us learn important drugs one by one. First one is phenytoin. One of the oldest and most important drugs for anti-epilepsy. It blocks the voltage gated sodium channels and it also prevents the repetitive neuronal firing. So their uses are tonic-clonic seizures, partial seizures, and status epilepticus. And it will not used in absent seizures. Okay, you can remember this point carefully. Next, the adverse effect of phenytoin is uh, nystagmus, ataxia, diplopia, and sedation. Next, gingival hyperplasia. It's a very famous side effect of phenytoin and gums enlarge, and the patient should maintain oral hygiene. Next, hirsutismus, nystagmus, ataxia, diplopia, and sedation. Next, gingival hyperplasia. It's a very famous side effect of phenytoin and gums enlarge, and the patient should maintain oral hygiene. Next, hirsutism, which means excess hair growth. The next, megaloblastic anemia. It due to folate deficiency and peripheral neuropathy, osteoporosis, teratogenesis. This teratogenicity can cause fetal Heidelberg syndrome. Next, purple glow syndrome. It's seen with IV administration. And interactions of melatonin is it induces liver enzymes. So it decreases the effect of many drugs. And the patient taking oral contraceptives may develop contraceptive failure. Next, you can imagine a patient with epilepsy. He starts taking phenytoin. After some months, the seizures are controlled, but he noticed gum enlargement. So now many patients stop medicine because of cosmetic concerns. Then the seizures return. This is why patient counseling is essential. So the doctor should explain, do not stop medicine suddenly. And this is a real life pharmacology, so not just a theory. Okay, do you understand? I think you can understand. Okay. Next, carbamazepine. This is very important drug. It blocks the sodium channel and it used for partial seizures, tonic-clonic seizures, trigeminal neuralgia, and bipolar disorder. Uh, the adverse effect of carbamazepine is diplopia, ataxia, sedation, and nausea. And some serious adverse effect causes aplastic anemia, granulocytosis. Granulocytosis means the blood count monitoring is important. Okay. Next, it may cause hyponatremia and it causes Stevens-Johnson syndrome, especially in some Asian population. Very dangerous skin reactions. And you can memorize the sentence. Carbamazepine damage bone marrow. Okay, this is bone marrow suppression. Next, sodium valproate. This is broad spectrum anti-epileptic drug. It very commonly used, and it blocks sodium channels, increases GABA, and it blocks calcium channel. So it works through multiple mechanisms. Okay. Next, uses of sodium valproate is tonic-clonic seizures, absence seizures, myoclonic seizures, bipolar disorder, migraine prophylaxis, and it is a very versatile drug. Okay. Next, it has some severe adverse effects: weight gain, tremor, hair loss, GA upset, hepatotoxicity, and pancreatitis. And also, it causes teratogenicity. And also it has neural tube defect, especially spina bifida. So it is avoided in pregnancy when possible. Okay. And sometimes the doctors avoid valproate in young women because of teratogenic risk. This is why pharmacology becomes clinical decision making. The drug selection is not only about seizure control, it is all about age, pregnancy, occupation, side effect, compliance, and cost. Next drug is ethosuximide. It is very important exam drug. Okay, It blocks the D type of calcium channel and the risk drug of choice for absence seizures. And the adverse effects are J, distress, fatigue, headache, and urticaria. And then ethosuximide sucks for absence. Next, phenobarbital. It is one of the most oldest drugs and it enhances GABA action, increases duration of chloride channel opening, and it is used for generalized seizure and neonatal seizure. And the sedation, cognitive impairment, respiratory depression, dependent are the adverse effect of phenobarbital. So not preferred nowadays because of excessive sedation. Next, benzodiazepines. Examples diazepam, lorazepam, and clonazepam. It increases frequency of chloride channel opening via GABA A receptors. It is used for status epilepticus, acute seizure control, and myoclonic seizures. Next one is lorazepam. It is commonly used in status epilepticus. The adverse effects are sedation, respiratory depression, and dependence. So the status epilepticus management is very important in clinically. So imagine a patient continuously convulsing in emergency room. What will doctors do? Yes, they maintain airway, breathing, and circulation, and then give IV benzodiazepine, usually lorazepam or diazepam. In long-acting control, the phenytoin, phosphonatoin, valproate are given. So, if still uncontrolled, the phenobarbital or general anesthesia is given for the patients. So, the status epilepticus can kill patients. So, rapid treatment is essential. Next drug is lamotrigine. It is a modern anti-epileptic drug. It blocks sodium channels and decreases glutamate release, used for partial seizures, generalized seizures, and bipolar disorders. The advantages of lamotrigine is less sedation and better tolerated. And the adverse effects are Stevens-Johnson syndrome. Mainly, it is a life-threatening rash, and the dose should be increased slowly. Next one is levothyroxine. It is a very popular drug nowadays, and it binds synaptic vesicle protein SB2A, and it modulates neurotransmitter release. The uses are partial seizures, generalized seizures, and myoclonic seizures. It has some advantages. It will favor drugs interactions, better safety profile, easy to use. The adverse effects are irritability, mood changes, and drowsiness. Then the topiramate is sodium channel blocker and it decreases GABA and reduces glutamate activity, used for epilepsy and migraine prophylaxis. The adverse effects are cognitive slowing, kidney stones, weight loss, tingling sensation. So students often remember this. Topiramate makes people slow. So because patients may complain difficult concentration. Next one is gabapentin and pregabalin. It acts on calcium channels and used for partial seizures, neuropathic pain. And the adverse effects are sedation, dizziness, and weight gain. So many drugs are used to treat diseases. Okay. So I will end up with the class. Thank you. Thank you so much.